Hi, I'm Dr. Nicky Plementosh. I am a OBGYN in Green Bay. I'm also Josh Pierce's stepmom. I am board certified in OBGYN, also a member of the American College of Obstetricians Gynecologists. I'm on the board of the American College of Surgeons and International College of Surgeons. When Josh was visiting me at one time recently, we were talking about the abortion issue, especially now with Roe versus Wade being overturned. It's in the news, it's everywhere talking about abortion rights. As an obstetrician, I certainly have to deal with this issue with my patients. However, I do not do abortions. I am pro-life and do not do abortions. Fortunately, where I live, we do not do abortions in this town. Patients have to go elsewhere to obtain an abortion. I certainly have a lot more patients in my practice that do abortion versus giving up for adoption, even though when a patient comes to me and says that she doesn't want the pregnancy, I strongly encourage her to think about adoption because it's very disheartening to have a couple come in who has tried and tried to have a baby and is told they can't and they want to adopt and there's not babies available to adopt. And I think a lot of this has to do with the abortion issue. Occasionally, and fortunately too often, I have patients who come in and find out that the fetus has passed away. Sometimes we can treat those with medication, or a patient will pass the pregnancy on her own. But occasionally we do have to go to surgery in order to take care of the fetal loss. If it's not treated surgically or removed from the uterus on its own, then the mom can get very sick. She can get septic and get an infection. And so the fetus does have to be cleared from the uterus. Unfortunately, the procedure that we do is the same thing that they do for an abortion for a live fetus. It's probably one of the most difficult procedures that emotionally that I have to do for a patient. I do have to do the procedure because I have to take care of my patient and clear the fetal tissue on a loss from her. It's very difficult. I can see fetal tissue being extracted when I do that procedure. And I know I have to do it and it's not a live fetus, but it still is very emotional to do that procedure. And all the time, every time I do it, I think about this same procedure is being done on live fetuses. What does that fetus experience when the procedure is being done and it's making that fetus come out in pieces? How horrible that must be. And I don't think a lot of people that consider abortion think about that. But as a clinician and having to deal with it, it's very difficult. I do a lot of procedures, and some aren't very pleasant, but this one is the worst for me. And I've been in practice 26 years. And I've done numerous ones of these over the years, and I had to do one like a week ago. And it still bothers me to have to do it, but I know I have to do what's right for my patient. I'm not killing a fetus, I'm taking care of one that's already passed away. I cannot imagine doing one on a patient who has a live fetus. I've delivered probably 5,000 babies or more in my career, and it's a wonderful experience, even when the pregnancy isn't planned or it's a young person situation. Actually, someone asked me this question today. I was talking to them about abortion, and they said to me, "Well, I don't know how I feel. I don't believe in abortion, but I don't know how I would feel if my 12-year-old daughter was raped and became pregnant. Would I want her to go through that?" And I gave her my opinion. I said, God gives life no matter what the situation is. Yes, that child has already been traumatized, and God will help her through that and help her through the pregnancy. But she can go through birth knowing that she is going to give that child to someone that wants the child and will love that child and will raise that child, versus, first of all, going through a rape situation and then going through a termination, an abortion that will haunt her the rest of her life. Many women who have had it years later, they're still feeling the trauma of what they have done. So I think there are certainly options to pregnancies with incest and rape. No one wants anybody to have to go through that, but God gives us the strength to deal with it. He gives us life, and he loves that infant, fetus, however you want to call it, from the time of conception. And that's the way I feel too. And it's not my place to take away life.